Okay, good evening, students. Hope I'm audible. Fine. So, this is the last class for Farre series. Uh, we are going to see some practicals, the concepts related with practicals. We completed most of the theory things we have completed. We are focusing on practicals today. Practicals, what we will see here. Okay. So, what is commonly there? Good evening, guys. What is commonly will be there is good evening. Commonly, what we have is we have these problems we have. Clinico-social case will be there usually in every college. What else we cannot discuss here much because it varies with the college. So let's see problems and clinico-social case. Okay, what is we have to focus? A clinico-social case, what we have to focus on? That I will tell. Every case is there. So what is the objective and what we have to focus? Crisply I will discuss. So with this context, we will start the class. Fine. Now, first is let us start with the problems. We'll start with the problems. Okay, fine. So some colleges it may be there, some colleges may not be. So this is a problem on chi-square test case. Okay, chi-square test. Okay, fine. Fine. So you just see for theory question also chi-square test will be asked. Okay, for theory also chi-square is asked. So you can write the theory also if it's not asked in a practical. So 100,000 randomly selected samples. Among them, a immunization audible. So let's see here. Hope I'm audible, guys. Now, so now, fine. Now, so this is fine. Now, look here. 1,000 random selected people. So among them, okay. So let's see. Okay, there are 480 males were there, and 520 females were there. 520 females were there. It should be available, guys. It should be available. Vidhi, it should. Two internets are having. Fine. Now I think it's there. Now the solution here is okay. They want to see whether there is a difference is there between the immunization program and the gender, guys. Okay, fine. So first we have to assume the hypothesis. What is the hypothesis here? Okay, first is null hypothesis. We are going to make an assumption that there is no association between program and gender. There is no association between program and gender. Okay, second one, I will check and I will message you guys in this group. I will message in this link. Okay, in this message YouTube for this video you message. I will ask them and I will confirm it, guys. Okay, Rehan Khan, I will confirm it. Fine. There is no association between program and gender, and I will write the alternate hypothesis that there is association between program and gender. So after that, what I will do is that, and I will go for the chi-square formula. Chi-square formula. Chi-square formula I will calculate summation observed minus expected by expected whole square. This is a chi-square formula. Observed minus expected summation. Okay, you are going to add everything. Observed minus expected by expected. Okay, whole square. Fine. How will you calculate these expected values? How will you calculate the expected values? Okay, you will calculate row total multiplied by column total divided by grand total. That means, okay, fine. So how to know which test to apply? Okay, fine. You can see the table, guys. You can see the table. Okay, you can see the table. Most likely if they are asking table value they have given. This is chi-square table value. Okay, if I want chi-square, I will give you chi-square table value. I will give two tests we can do. This is qualitative data. This is qualitative data. This is quantitative, this is qualitative data. That means it comes in percentage. For percentage, we can go for this chi-square test. Okay, fine. And also the table value is given 3.84. This level of significance that corresponds to chi-square value, chi-square table. Fine. So you use this chi-square formula. Use it. Okay, observed value minus expected divided by expected. Okay, how will you calculate the expected is expected frequency row total multiplied by column total divided by grand total. This is row total. This is row total multiplied. This is column total. This is row total divided by grand total. Similarly for the other one, this is column total. Okay, row total. Okay, fine. Now, if you do the calculation here, I'm just giving outline. This document is going to be sent to you. You can go through it, guys. Okay, we have these four values. For the first one, the expected value comes around 288. For the second one, the expected value comes around 192, guys. Okay, 192. Okay. For the third one, expected value comes as 312, and fourth one is 208. Okay, fine. You are going to calculate the expected frequencies for two things in rows and two in column. Fine. Now what we are going to do here? Okay, observed value 416. This is the 416. This is the 416. For that we have calculated expected value is 288. What is the formula I said? Observed value minus expected value. Okay, we have subtracted it, then squared it, guys. Then squared it. Then we have divided with the expected value. For every row you are going to do it. Okay, fine. Similarly, this is 64 we have. For 64, expected value is 198, 192. You subtract it, square it, then divided by expected value. If you do all these things, you will get chi-square value of, you are getting chi-square value of this. Okay, you have to do the calculation. Anyway, the document is sent to you. You can go through it later on. The calculated value is 273. Okay, fine. Now, whenever we are doing this chi-square value, manual calculation, we have to calculate the degree of freedom. The degree of freedom formula is column minus 1 multiplied by row minus 1. How many columns we had? 2 columns, 2 rows. The degree of freedom is 1, guys. Okay, the degree of freedom is 1. 1 is the degree of freedom. Fine. Now, so table value for degree of freedom of 1. This is chi-square table value. This is fixed, guys, 3.84. If they are not giving, we have to remember. Okay, for degree of freedom 1, it's 3.84. If it is other degree of freedom, they are supposed to give it in the practical exam. Okay. Now, if the calculated value, okay, greater than table value means, okay, I am going to reject null hypothesis. If calculated value greater than table value means I am going to reject null hypothesis and I am going to accept the alternate hypothesis. These are the steps, guys. Repeating the steps again. So the question is asked, okay, is there a relation between immunization and the gender? Okay, that is what the question is. Okay, immunization and gender, is there a relation? Is there? Okay, fine. Now, first we will fix the null hypothesis. What is null hypothesis? Okay, there is no relation between immunization and gender. What is the alternate hypothesis? There is a relationship. Okay, since it's a qualitative data, it comes in percentage, guys. Immunization done, not done, male, female, that is quality. So then I am going to do the chi-square test. Chi-square test formula, what is the formula? Summation observed minus expected whole square by expected. This is summation for every cells we have to calculate. Okay, so this is the chi-square value. The chi-square value is 273, what we have calculated. Okay, then we have to go for the degree of freedom. What is the formula for degree of freedom? Column minus 1 multiplied by row minus 1. Column minus 1 multiplied by row minus 1. Okay, the column, whatever we have calculated, that is greater than the table value. What is the table value? Table value is already fixed. Chi-square table value for this 1 degree of freedom is 3.84. So ours is 273. So the table calculated value is greater than table value. and I am going to reject null hypothesis, and I am going to accept alternate hypothesis. That means there is an association between gender and immunization. There is an association is there. This many points you have to write it. Okay, fine. We'll go to the second model problem. Okay, we'll try to see all the problems here. Okay, fine. Find the significance of difference between mean weight of 50 girls and boys with the following. So we have to find the mean weight. Now you have to tell me what is this weight is what? Weight is measurable, guys. Measurable, we can go with quantitative data. Quantitative data, we can use Z test here. Z test. Okay, we can use Z test, we can use quantitative data, we can use Z test. Okay, fine. For mean, okay, they have given the mean for girls is 42.4 with a standard deviation of 3.6. For boys, it is 48.6, standard deviation of 2.3. Now they are asking, is there a difference between the mean weights between boys and girls? Is there a significant difference? That is what they want to find. Is there a significant difference? Is there? Now, what is the formula? How to calculate? What is the null hypothesis? Always null hypothesis will be there is no significant difference. No significant difference between mean weight of boys and girls. And the alternate hypothesis is always there is a significant difference between boys and girls. This we have fixed it. So null hypothesis means no significant difference. Alternate hypothesis means there is a significant difference. Now what is the formula here? What is the formula? So test statistics is Z is equal to difference between the means. Okay, first group and second group between boys and girls divided by standard error of difference between the means. Standard error formula is SD by SD1 by N1, SD square by N1, SD2 square by N2. Okay, this is the formula, guys. Okay, fine. Now what is the difference between the two means? 42.4 here, 48.6. Okay, so first group and second group. Denominator is 3.6 square. This is the 3.6 square for girls, and for boys it is 2.3 square. 50, N is 50. If you do the calculation, okay, you do the calculation 6.2. So if you do the square root and all, we are getting Z test value as 10.26. Okay, so we are getting Z test value of 10.26. Okay, fine. So now the table value for Z test, okay, at 5% level of significance, this they are supposed to tell us. They are supposed to give. Okay, so if I am doing the calculation, I will give. Or otherwise, if it's a Z test, you have to remember 5% is 1.96. Okay, fine. Now the table value, the calculated value again, okay, is greater than the table value. Now tell me whether to reject null hypothesis or accept null hypothesis. Yes, guy, you can answer it. The calculated value is greater than the table value. Now what to do, guys? Now what to do? Whether to accept or reject null hypothesis. Okay, the calculated value is greater than the table value. 10.26 is greater than 1.96. So what we are supposed to do? We have to reject null hypothesis. Therefore, boys weight are boys. Okay, look here. Boys are significantly having more weight when compared to girls. Yes, guys. Okay, we have to reject the null hypothesis. We have to reject the null hypothesis. Boys weights are significantly more. Okay, so this Z test and chi-square test, the difference is here the Z test can be used for quantitative data, that is measurable data, and we have the chi-square test, that is qualitative data. Okay, percentage. Okay, those conditions we can use it, guys. Okay, fine. So what are the steps? Excellent, guys. Okay, excellent. So what are the steps here? I'm repeating again. So first you state the null hypothesis, there is no significant difference. Second step, you are going to say that there is a significant difference. Then you use the Z test. Okay, difference between the mean divided by standard error of difference between the two groups. You do the calculation, the table value, whatever value you got, that is more than the table value of 1.96, you reject the null hypothesis. Now, this is a very common question, simple question they ask in the exam. They given the 10 values they have given, and they ask here, okay, they are asking here, okay, fine. Now, so Calculate mean, median and mode. Okay, these are called as, otherwise they may use the term called as measures of central tendency, guys. Measures of central tendency, they may use it. Okay, what is mean means what? This is very easy. Mean is, okay, what is sum of all the observations divided by total number. So you add all the number divided by total number. This is 8.6, guys. 8.6. What is the question, guys? In chi-square test, that percentage is, okay, fine. Back, response, rehabilitation, mitigation. Okay, we will answer it, guys. I will answer fine. The first is mean. At the end, we will answer, guys. Okay, you ask me the question, then whatever doubts are there, I will try to answer this. Okay, fine. So first you calculate mean. Then what is median? Median means, okay, median means middle value. What is median means? Median means middle value. Okay, arrange the data in either ascending order or descending order. We have arranged it. This is even numbers. 10 numbers is the even numbers. So what you have to do? You have to do add the two middle values. That is 8 plus 9 by 2. 8.5. That is median. Okay. So mean means average. Median means middle value. Arrange the data in either ascending or descending order. Find the middle value. Odd number means not a problem. Even number means divided by 2. What is mode? Mode means most repeated value in the data, guys. Okay. So which number comes again and again? So for us, which number came again and again here? 6 came. Again, what we have, 9 2 times came and 8 2 times came. So we can say that mode is, okay. So these are the three values. You just summarize it. You just summarize it. What is mean? What is median? What is mode? Straightforward, very simple question. We should not make mistakes. Okay, fine. The mean, median and mode. These are measures of central tendency. Next is, what is measures of dispersion? This is asked in the practical. What is measures of dispersion? What is measures of dispersion? Measures of dispersion. Okay, fine. The first one is range. It's not range actually, it's range. What is range means? Okay. What is range? Range. Okay, range. Range means maximum value to minimum value. This maximum value to minimum value. What is the largest value in the data and what is the smallest value? So that we call it as range. Okay, the largest value here is 73 and smallest is 5. So the range is 68. This maximum value to minimum value. Okay, fine. Weakness of chi-square means what? In what context you are asking? Okay, what context you are asking, man? Weakness of chi-square means what is the context? Okay, fine. So now maximum value to minimum value, guys. This is the first one. Second, you can go for standard deviation. What is standard deviation? Standard deviation will tell you. Standard deviation will tell you deviation from mean value. How much the data is deviated from the mean. Okay, fine. So square root of summation x minus x bar the whole square by n minus 1. Students commonly make mistake, either n or n minus 1. Okay, so it's n minus 1 because when the n is less than 30, the formula is n minus 1, guys. Denominator comes as n minus 1. When n is less than 30, the denominator is n minus 1. Okay, so don't forget to subtract 1 from the total number here. Okay, fine. Now, so you do the calculation here. Step by step, you do the calculation here. So we have this individual observation. First, you calculate the mean. You calculate what is the mean here. Okay, mean you have calculated, that is 43.5. You add all the values divided by the total number, that is 43.5. So now see here, every value you subtract it from the mean. Mean here, how much is the mean here? Mean is 43.5. Every value subtracted from 5. Okay, you just subtract it, you get this value. This you have to do manually, guys. Okay, then square it. Then square it. Square it. Okay, then square it and add all the values, guys. Okay, So add all the values. This is 6518 divided by total number n minus 1 9. So what you are getting is 26.9. Am I clear? So this is standard deviation. This is standard deviation. And fourth one, what is variance? Variance means SD square is variance. Variance. And you have to square the 26.9. You are going to square it, guys. Okay? 26.9. You are going to square it. Okay, fine. This commonly asked. This is also commonly asked. Okay. First is range, maximum value to minimum value. Then you have to find the standard deviation. When you are finding standard deviation, you require mean. You calculate mean. So what is the denominator in standard deviation? Most of the time you will be given 10 values or 15 values. Okay, we may not give more than that. So then it's a problem. So the denominator is always n minus 1. Remember, for you it's n minus 1. Okay, divided by 9, you get this standard deviation value and finally square it. So write all the answers together, guys. Okay, it's easy to give marks. Easy to give marks. Okay, as far as examiners are concerned. Okay, when they're correcting papers, okay, you write it all the values together. Don't make them to search for the answers, guys. Are we clear, guys? Okay, fine. I think it's hope I am clear. So we have seen 4 things we have seen. Mean, median, mode. That is measures of central tendency. Measures of dispersion we have seen. Chi-square test and Z-test we have seen. Next, let us go into calculate sensitivity and specificity, guys. Positive and negative predictive value. Okay, fine. They are using pap smear with a diagnostic test. They have given some values. Okay, fine. Now, what is the formula for sensitivity? Okay, fine. Look here. We have to understand. You are comparing a screening test with a diagnostic test. So that is cancer cervix present, cancer cervix absent, disease screening test positive, screening test negative. Now, among the patients, okay, how many people are screening test positive? That is 80. So this is true positives. Okay, among those who are screening test present, but still it is negative. This is false negative. So among those non-diseased persons, screening test is positive. This is false positives. This is true negative. Okay? You are comparing a screening test with a diagnostic test. So you are saying that whenever in a diseased patient, screening test is positive, that is true positives. Okay, in a normal person, if it is negative, true negative. In a normal person, if a screening test is positive, that is false positive. If it is a diseased person, if it is negative, false negative. Now tell me, what is the formula for sensitivity? Sensitivity formula is true positives by true positives plus false negatives multiplied. Or you may write it as A, B, C, D also. Maybe that's how you'll start in your class. Okay. A by A plus C. Okay, fine. Now, how much is the sensitivity here? 80 by 80 plus 20 multiplied by 100. That is 80%. Okay. So, among those 100 diseased persons, the screening test can directly identify 80 people. Okay, 80 people. Right. This is sensitivity. What is specificity? What is specificity? True negatives by true negatives plus false positives multiplied by 100. True negatives by true negatives plus false positives. Okay, fine. So what is the answer here? 850 divided by 850 plus 50 multiplied by 100. This we are going to call it as specificity. This we are going to call it as specificity. Specificity. Okay, fine. We'll find the total values. Third one, positive predictive value. True positives, denominator all are positives. True positives, denominator all are positives. True positives plus false positives. How much is here? 80 and 50, guys. 80 and 50. So that is 80 by 80 plus 50 multiplied by 100. This is positive predictive value. A positive predictive value. A negative predictive value is true negatives, denominator all are negatives. True negatives plus false negatives multiplied by 100. So this is here 850 and 20 guys. 850 and 20. 850 by 850 plus 20 multiplied by 100. So am I clear? Okay, fine. So finally, if you do the calculation, this is the answer you are going to get. Sensitivity 80%, specificity 94.4%, positive predictive value 61.5%, negative predictive value 97.7%. I have done the calculation. You can go through it. Okay, just again I'm telling you. Look here. What is sensitivity? Sensitivity means what? You are comparing a screening test with a diagnostic test. Okay, sensitivity means true ability of the test to identify true positives. Okay, so true positives by diseased people. Okay, so true positives by this one guys. True positives plus false positives. Never forget to write the formula. Every step has marks. Specificity, true negatives by, okay, non-diseased people. That is true negatives plus false positive. Okay, fine. Positive predictive value, true negatives, true positives, denominator all are positives. Negative predictive value, true negatives, all are negatives. Okay, fine. Make sure that you write this. Okay, make sure that you write this. Fine. Yes. Okay, so we completed screening chapter question. We'll go to the next question. A study was conducted to find the effect of forceps delivery on mentally retarded children. Okay, is doing forceps delivery causes leads to mentally retarded children, some form of hypoxia. Okay, birth hypoxia. On analysis of OG records, it is found that okay, at the time of delivery, outlet forceps were applied on 20 out of 100 children in mentally retarded, 5 out of, okay, normal group. Can you tell me what is this study? And calculate strength of association. Can you tell me what is this study, guys? Okay, that one I will leave it to you. So what is this study? Can you tell me what is this study, guys? First, okay, that is the first step. Okay, so we have to find the strength of association here. How will you find the strength of association? They have told that 100 children who are mentally retarded. 100 children who are mentally retarded. 100 children who are normal. Okay, what is this study, guys? What is this study? We have to make a 2 by 2 table. Okay, fine. Yes. It's a case control study. A case control study. Now we have to find the association between these two. Yes. Not cohort man, case control. They have told already 100 children mentally retarded. Out of them, 20 were applied forceps. Now let us take cases. Cases, controls, exposure positive, exposure negative. Satyajit, it is a case control study. Okay, fine. Now 100 cases, 100 controls. Now see here, out of 100 cases, okay, how many were exposure positive, guys? How many total cases are there? 100 cases and 100 control. Among 100 cases, how many were exposure positive? Among 100 cases, 20 were exposure positive. Remaining is how much? 80. Among 100 controls, how many were exposure positive? 5. Remaining is 95. 95. Okay, so now what study is this? Now what study is this? Okay, this is a case control study. What you can find in a case control study is you can find odds ratio. You can find odds ratio. What is the formula for odds ratio? Is AD by B. The formula is AD by BC. ABC comes in sideways, guys. AD by BC. Okay, it comes in sideways. Okay, AD by BC. Now, so 20 multiplied by 95, 80 multiplied by 40. Not 40 actually. Okay, fine. So this is how much? 950,900. 1900 by 400. So approximately it's 4.6 or 4 point, let us assume it's 4.8, let us assume. Okay, roughly we will say. Okay, fine, roughly 4.8. Okay, 4.8. So this is what is, this is odds ratio. Okay, this is odds ratio. Okay, so there is, what is odds ratio interpretation? Okay, equal to 1 means no association, more than 1 means positive association, less than 1 means negative association. So what does it mean? The odds ratio here, what does it mean? Okay, so forceps delivery. Okay, so as strong association, it looks like a, okay, strong positive association with the, okay, so mental retardation. Okay, so mental retardation means some form of hypoxia, some form of birth hypoxia, it can lead to mental retardation. That's what it's a positive association. That means it may be a risk factor, guys. It may be a risk factor. Now, am I clear? The question is this one. What they are asking is strength of association. What we are going to find is, here is odds ratio. This is odds ratio, and more than one, what does it mean? It may be a risk factor. Positive association means a risk factor of forceps delivery along with some leading to birth hypoxia, leading to mentally retarded children. Next problem, guys. Next problem. I'm just giving outline, guys. I'm just giving outline. Okay, so hope I'm just giving one problem. I'm not going deep. One problem. I just refreshing your memory. Okay, fine. Okay, they themselves given a cohort study, guys. Okay, so they have taken 100 cases. Okay, in a cohort study, 100 tobacco chewers were there. Among them, there were 100 cases of oral cancer. Okay, thousand tobacco chewers, 100 cases of oral cancer. 1,000 people not using tobacco. Okay, 10 cases were reported. Now they are asking calculate incidence rates, relative and attributable risk. Now tell me, what is the formula for incidence? Incidence means number of new cases. Okay, two incidents we can calculate. Incidence among exposed. Okay, incidence among exposed. Incidence among exposed is, okay, I'll write in short form, i.e. incidence among exposed. What is this? Okay, number of new cases. Always write the formula, don't do the calculation directly. Number of new cases among exposed by exposed population multiplied by 1000. Okay, so number of new cases by exposed population multiplied by 1000. So how much is the new cases? 100 by 1000 multiplied by 1000 is 100. Okay, incidence among exposed is 100. Okay, 100 per 1000. Second one is incidence among non-exposed. Okay, incidence among non-exposed. Non-exposed. So what is the formula? Incidence among non-exposed? Number of new cases, non-exposed population by non-exposed multiplied by 1000. The denominator here, what we are using is non-exposed group. Okay, non-exposed. Incidence means number of new cases. So what is the, how much it will be here? Okay, so how much here? 10 cases out of 1000, guys. 10 cases out of 1000. So 10 by 1000 multiplied by 1000. So this is 10 by 1000. Now third one they are asking is, what is relative risk? Relative risk. Relative risk. Relative risk is incidence among exposed, short form I am writing, guys. Incidence among non-exposed. 100 by 10, that is 100 by 10, that is 100. So what is the interpretation? Okay, odds ratio, relative risk, both are same, guys. Both measure strength of association. Okay, both measure strength of association. Relative is equal to 1 means no association. More than 1 means positive association. Less than 1 means negative association. Okay, fine. So here it is 10, guys. What does it mean? It's a positive association. So those who are chewing tobacco, they are 10 times more likely to develop oral cancer when compared to control. Those who are using tobacco chewing, those who are doing tobacco chewing, they are 10 times more likely to develop oral cancer compared to controls. Next is relative risk. We have seen. Next is attributable risk. Okay, what is the formula for attributable risk? Incidence among exposed minus incidence among non-exposed by incidence among exposed multiplied by 100. Exposed minus non-exposed by exposed multiplied by 100. So what is the formula we have seen here? 10 minus 1 by 10 multiplied by 100. This is 90%. Okay, fine. Okay, 90%. What do you mean by that? This is 90%. So 90 percentage of lung attributable risk says that how much percentage of disease attributed to the exposure among how much percentage of disease attributed to the exposure among that means 90 percentage of lung cancer among tobacco chewing people is because of tobacco. 90 percentage of not lung cancer, oral cancer, 90 percentage of oral cancer among tobacco chewing people is because of tobacco chewing. For remaining 10%, some other cause may be there, but 90 percentage of cause is tobacco chewing. Hope this is clear, guys. Okay, hope this is clear. The last problem. After that, we are going to discuss case. Just outline I will tell. Okay, fine. Calculate. They have given a mid-year population of 1 lakh, 2,500 live births, 700 deaths were there, 4 maternal deaths, and 100 infants. They are asking to calculate what is crude birth rate. What is crude birth? Crude birth rate is CBR. I will write number of births a particular year by mid-year population. MYP means mid-year population. Number of births a particular year by a mid-year population. Okay, fine. Now, what is this number of births? How much is number of births? It is 2,500 divided by what is mid-year population? That is 1 lakh multiplied by 1,000. So how much is it? Crude birth rate is 25 per 1,000 mid-year population. This unit you have to write correctly. Okay, don't just like that write 25. Okay, it's 25 per 1,000 mid-year population. You write it clearly. You write it clearly. Then only we can get score marks. Okay, these areas they will try to detect marks. Okay, don't give the opportunity for the teachers. Crude death rate. Number of deaths in a particular year by mid-year population multiplied by 1,000. Okay, number of deaths. Okay, so by mid-year population multiplied by how much is the death? 700 deaths. Is 700 by 1 lakh multiplied by 1,000. So how much it is? It is 7 per 1,000 mid-year population. 7 per 1,000 mid-year population. The crude death rate. The crude death rate is 7. Okay, 7 per 1,000 mid-year population. The third one is MMR, guys. Maternal mortality ratio. Numerator is number of maternal deaths. I am writing in short form, guys. Maternal deaths. Denominator is total number of live births. Live births multiplied by 1 lakh. This indicator we express in terms of 1 lakh, guys. No other indicator will tell in 1 lakh, but this one will express in terms of 1 lakh. Maternal deaths by live births. Maternal mortality ratio. Rate we don't calculate. Ratio only we will calculate. Okay, maternal deaths by live birth. Now see here, how much is the maternal death? I think we saw 4 maternal deaths. Live births is 2500. So this is 2500 multiplied by 1 lakh. Okay, fine. Now how much is it? Okay, how much is it? So this is 25,000 by 25, 4,000. This is 40, guys. I think it is 160 per lakh live birth. You should say specifically, guys. It should be okay. Unit you have to say very specifically 160 per 1 lakh live. This is maternal mortality ratio. It's live births, guys. Fourth one is infant mortality rate. Infant mortality rate. Okay, fine. Numerator is infant deaths. Okay, infant deaths. Denominator is number of live births multiplied by 1000. This comes in 1000, guys. This comes in 1000. So how much is the infant deaths? So we have seen the infant deaths are how much? 100, guys. So 100. Okay, so this is 100 divided by 2500 multiplied by 1000. So how much is it? So this is 1000 by 25, guys. Okay, so 1000 by 25 is how much? It's 40. 40 per 1000, like higher actually. Both are higher, guys. Suppose the question may say what is the national average? Okay, national average. Okay, if the question they are asking, compare it with the national average. MMR for India right now is 97 per 1 lakh live births. Infant mortality is around, I think infant mortality is 28, guys. 28 per 1000 live births. Okay, both are higher than the national average. So this is also higher. Okay, this is also higher. Okay, so infant mortality is 28. Both are higher than the national average. The question says that compare it with the national average. So am I clear? So these are the various problems, guys. Okay, I just seen what is commonly used problems. I have given an outline, guys. Fine. Now let's go to the case, guys. Clinico-social case. I'll just give a broad outline. I will give which area as an examiner we will focus. Okay, so if I'm an examiner, okay, which area I will focus. Now, so clinico-social case, you will have antenatal case, postnatal case, you will have diabetes, hypertension, okay. Under 5 children may be asked, okay, you will be given fever, TB, okay. Depends upon the areas, case, okay, what is available. If some places leprosy cases that they can give. But I will touch the first 8, I will touch, okay, what I discussed, antenatal, postnatal, non-communicable disease, and under 5 children, okay. So diarrhea and pneumonia, okay, and fever case and TB case. Okay, I just give a broad outline. General information you collected. Okay, age, sex, marital status, literacy rate, everything you calculate. But pediatric case, if you are specifically pediatric case, a pediatric case means you add informant. Who is the informant? Okay, you add who is the informant here, and what about their reliability? Okay, whatever the information what they are giving, is it right or wrong? Okay, that reliability you have to ask. It's a pediatric case. Pediatric case means you ask the informants. You ask chief complaints. What is the complaints? I will tell which area where to focus. I'm just giving first outline, guys. Chief complaints, presenting illness, past history. These are routine for any case. What you see in your clinics. Okay, what you see, any case. Okay, fine. Now, family history, contact history, personal history. Immunization history is important in case of under 5 children. Under 5 children, Okay, if you are seeing this one, make sure that you make a table and what are the vaccines given, 1 2 3, like that you have to mark it. What are the vaccines that is given, guys? Okay, whether BCG is given, OPV is given, okay, IPV, okay, whatever to the age, okay, what are the vaccines? If you're making a table, that will tell me that you know the national immunization schedule. Okay, if you have time, try to do it. Okay, so what are the vaccination given? So the question may go into national immunization schedule, which you can easily answer. So focus, don't go to exam without studying national immunization schedule, guys. National immunization schedule, especially if you are seeing a under 5 children. Next, what else is different here? When compared to other subjects, the clinico-social case, we have to ask diet history. Okay. The common method what we are going to use is, you are going to use 24 hours recall method. Okay. This is more easier method which we can do it. In last 24 hours, what is the food you have taken? So breakfast, lunch, snacks, and how much quantity, and look for calories. Okay, fine. If possible, proteins, you can do it. The park they would have given, okay, which food gives what, how much pova gives, how much roti gives, how much dal, a cup of dal gives, how much idli gives, how much dosa gives, how much cup of chai gives. Okay, it is given. Usually some colleges they can give it there in the exam. Some colleges you have to know the content. Okay, for example, one idli gives 75 calories, like that. Okay, fine, that you have to know. This we call it as 24 hours recall method. Fine. Second, this is the first. You have to say that I have used 24 hours recall method. Okay. Next, what type of worker is your case? Type of worker. Okay, what type of worker is your case? Okay, fine. Is he a sedentary worker, moderate worker, or heavy worker? Okay, fine. Third step is how much is the actual requirement, we will see. And finally fourth step is, okay, how much he is taking, you calculate how much your case takes, then what is the deficit or excess, guys? What is the deficit or excess? 5 points I want. Okay, fine. One is what method we use, type of worker, how much calorie is the requirement, and whether there is, how much this person is taking, whether deficit or excess is there. For example, these are the list of workers. These are the listers. Who is a heavy worker, who is a moderate worker, light worker, you can see. Doctors will come more in a light worker. Housewives, you may see lot of time housewives will come in moderate worker. Moderate worker, you can go through this chart, you can go through it and tell me who is the which type of workers. Fine. Next is nutritional requirements, guys. This you should know. Adult male, sedentary worker, how much calorie is required, moderate worker, heavy worker. Female we have given, plus additionally if it's a and C case. If it's a and C case, antenatal case, then how much is the requirement? Suppose she is a sedentary female, 1660 plus 350 calories. Okay, plus 350 calories. So this is how much? 2010 calories. This is antenatal case. Postnatal case, suppose you are there, the postnatal case will be given to you. So 1660 plus 600 calories. So that is how much? 2260. So don't make mistakes here. Okay, fine. This is the antenatal postnatal case. This you have to tell. Okay, so are we clear? So the requirements you have to tell it clearly, guys. Okay, how much is the requirement? This case. So 4 5 headings I want. Okay, first is what type of worker, what 24 hours recall method, what type of worker, how much is the requirement, how much they consume, whether there is a deficit or excess is there. Okay, fine. Then you can use this socio-economic status, guys. One of the new things here, socio-economic status classification. Okay, socio-economic status classification. Okay, Kupusami scale, we can use it for more urban areas. Includes three parameters: education, occupation of the head of the family, and the family income. Education, occupation, okay, and family income. Based on that, you will make a score. At least you should know it is made up of what parameter: education of the head of the family, occupation, and we have this income, guys. So these are the education, guys. Okay, we can divide the education like this. Okay, scoring can be done. Okay, whether it's a postgraduate is there, graduate, okay, professional or semi-professional. Okay, like that you can score them. Fine. Similarly, we have this this income category is there. We have income is there. So based on the family income, we can do the scoring. We can do it. You have to practice. You have to practice. Teachers will look for it strictly. Okay, what is the socioeconomic status based on what you have calculated? How you calculated? They may ask. Fine. Based on this, you can say whether the person is upper class, upper middle, lower middle, upper lower, or lower. You can categorize them. You can categorize. This is socio-economic status classification, which you are supposed to do, or you should know. Whether you are doing it or not, different story. But you should know, guys. You should know. Next, you can use BG Prasad classification. This is more simpler one. Okay, sometimes you can go with this also. It's more simpler one. It is mostly used for rural areas. Okay, and BG Prasad classification. This is based on per capita income, guys. Per capita income. This is income per person. Okay, income per person. This is per capita income, guys. Okay, so you take the per capita income. Based on that, you can classify them. They belong to which group? Okay, scale 1, 2, 3, like that you can calculate. So what is new here? So far, diet history is new, and socioeconomic status is new. Then environmental factors you have to ask. Environmental factors has a lot of effect on health. Okay, especially if you are looking for a case of fever, TB. Okay, TB under 5 children. Under 5 children, okay, maybe diarrhea or pneumonia. Environmental factors, these 4 cases, it's important. Okay, may not be relevant for antenatal, postnatal, or diabetes or hypertension. But if it's a case of fever, if it's a case of TB, okay, under 5 children, we have to see. Okay, what we have to see, I want that, make sure that you write about overcrowding, whether overcrowding is there or not. Okay, fine. Type of fuel used for cooking, separate kitchen is available, because maybe indoor air pollution, child may have pneumonia. Okay, fever. Okay, and source of water, that is also important here. Source of water, that is also important here, especially here fever, diarrhea is there. Okay, when you're suspecting typhoid, the environmental factors is important, and especially if you're looking for vector-borne disease, okay, breeding places, you are going to ask, is there some breeding places in and around the houses? If you are looking for a case of TB, I want to know overcrowding, ventilation. This you have to ask. Just keep that in mind. Train your mind like that. Okay. If it's a case of fever, environmental factors, I should focus on water, food sanitation. Okay. Whether they are using some boiling measures, that you have to focus. Okay. If it's a case of TB, whether overcrowding is there or not, everybody is sleeping in the same room. Okay. That we have to see. So this is overcrowding. This is overcrowding. This is the criteria. This is the easiest one for you to use. Okay, one room, 2 persons. You can ask how many living rooms are there. First, you ask the question, how many living rooms? How many living rooms? Then you can ask, okay, how many people are there? One room, 2 persons. 2 rooms, 3 persons. 3 rooms, 5 persons. Based on that, you can calculate. Okay, this is overcrowding. Easier one. Fine. Now we have done, okay, so history. So important one is diet, important one is socioeconomic status, and important one is environment history. In clinical examination, like any other thing, history are going to ask, but what is more important is anthropometry. Okay, this is important, especially in a NCD case. Okay, non-communicable disease, make sure that you check height, weight, BMI, waist circumference, hip circumference. Okay, you take it. Okay, fine. Now Again, this is important in under 5 children, because we want to rule out malnutrition. Okay, we want to rule out malnutrition. Under 5 children, we want to rule out malnutrition. So make sure that you check the weight, height, okay, and the mid-arm circumference. Okay, so 6 months to 5-year child, okay, you check the mid-arm circumference. Make sure that you do it, because we want to know whether the child is malnourished or not. That we want to know. Then you do systemic examination based on symptoms. Okay, so whatever system, one system you detailedly examine. What is this clinico-social diagnosis? What is this clinico-social diagnosis? Clinico-social diagnosis you are going to make. Clinico-social diagnosis. Okay, all the positive findings. All the positive findings plus you write the socio-economic status, diet status. Okay, this you have to give. Clinico-social diagnosis, you make all these things. All the positive findings, socio-economic status, diet, if anything is there, okay, that you are going to mention in clinico-social diagnosis. Based on this, we can do management based. Okay, individual level, family level, community level, national programs related with this. Okay, this is a broad outline. This is a broad outline you are going to do. What investigation you would like to do in this case. Right. Now let us start for a non-communicable disease case. Okay, let us start for a non-communicable disease. Suppose it's a case of diabetes and hypertension. So what to focus here? In case of diabetes and hypertension, what is the primary objective? What is the primary objective? Listen, the patient also know the patient is having diabetes. The patient also know that they are having hypertension. So what is being expected from you is, okay, main objective is to identify what are the risk factors, what are the complications. So basically, you have to identify what are the risk factors and what are the complications. Okay, fine. Complications, the patient. Okay, and if they are already a known, if they are already a known hypertensive, known diabetic case, whether they are in, okay, regular adherence to the treatment. Okay, fine. Regular adherence to the treatment. Okay, so to identify risk factors, complications, and what do you want, need motivation. To identify risk factors and complications, regular adherence to the treatment, guys. This is what the objective. Now, if a case of diabetes, what are the complications you can expect, guys? In the case of diabetes, what are the complications you can expect? You can expect retinopathy. Okay, you can expect neuropathy. You can expect cardiovascular disease. You can expect nephropathy. Okay, these are some of the complications you can expect. Okay, you ask questions related with this. So ask questions. Okay, whether you ask them. Okay, fine. Okay, so whether you retinopathy, neuropathy, CVD, cardiovascular, neuropathy, what you can ask? You can ask whether they are having some peripheral sensation. You can ask peripheral sensation, or you can do foot examination. You can do. Okay, cardiovascular disease, you can ask whether they are having chest pain or not. Okay, so these things you can ask. Fine. Next you have to look for risk factors, and especially in a diabetic and hypertensive patient. Okay, measure BMI. Okay, waist hip ratio, waist circumference. Okay, waist circumference. Okay, risk factor, look for what are the risk factors are there. Is there any risk factors? Okay, complications are there or not, whether they are taking the drugs regularly or not taken. If they are not taking the drugs, based on these things, we can do investigations, okay, and we can plan a manage. This is what we expect from you. This is what we expect from you. Okay, so if you are a that the thought process as a teacher, we expect that in a diabetes and hypertension case, okay, are you looking for risk factors, are you looking for complications, are you looking for treatment, adherence for treatment? Okay, fine. So did you check the anthropometry? Sometimes what they do, patients they will come for a case of hypertension and they didn't even check blood pressure. Then what is the point of taking the case? Understand that. Okay, it's a case of hypertension, means diabetes, means you are supposed to check the blood pressure. Okay, the patient is having some form of peripheral sensation, you should at least examine that is there some sensation is there or not, that you should examine, and based on this you can write the investigations and we can plan a management. This is what is expected. I'm just giving crisply, guys. I'm not going in detail what we are going to write in the management. What is the purpose of this antenatal case? What is the purpose of antenatal case? Look here. You are checking, one antenatal case is given to you. What is the purpose? The purpose is to identify whether it's a high risk case or high risk case. Okay, whether it's a high risk case or not. Okay, fine. So you have to look for the age, the height you have to see. So make sure that you measure the height. Prime less than 145 centimeters. Okay, malpresentation, breach, transverse lie. For that you have to examine the baby. For that you have to examine the baby. Okay, then how will you know that whether it's a case of malpresentation? Okay, examine. Antepartum hemorrhage, threatened abortion, you ask the history. You should ask in the trimester history. Pre-eclampsia, you are going to ask with the check the BP measurement. Okay, BP measurement. Okay, anemia, look for pallor. Okay, clinical examination. Twins, examine the baby. Okay, fundal grip. Okay, that you are going to do. Then previous IUD is there, intrauterine deaths, prolonged pregnancy. So you have to calculate EDD. What is EDD? Expected date of delivery. LMP plus 9 months and 6 days. Last menstrual period. Okay, plus 9 months and 7 days. Okay, 7 days. Okay, 9 months and 7 days. Okay, you are going to calculate the LMP, whether it's a prolonged pregnancy or not. Then you are going to ask previous history of cesarean section, instrumental delivery, or any cardiovascular disease. Where your job, what is the primary objective? I am repeating here. The primary objective is to identify whether it is a high risk case or. Am I clear? After this, based on this, you can give advice. You can go for management. You can tell them what investigation they should do, what they have to do individually, family level, what they have to do. Okay, this is the outline, guys. I'm just telling the outline. I'm not going deep there. Okay, so that will take time. Booked case and other things. Okay, the primary objective, this is the primary objective, is to identify whether it is a high risk case or not. This, if you are doing it, then you are doing good for the patient. What is this postnatal case? Postnatal case. Okay, look here. What is the purpose of the postnatal case? To rule out, you are doing to rule out postnatal complications. What is the purpose? The purpose is to rule out postnatal complications. What are the complications you are expecting, guys? What are the complications? Okay, most of the time I have seen students, they will come with a postnatal case and they didn't even have this as the symptoms of postnatal case. They won't even ask the complications. Okay, so what is the postnatal case complication? Hemorrhage. Okay, hemorrhage. Okay, features of any sepsis is there or not? Okay, hemorrhage. Okay, so is there bleeding? PV is there? Okay, sepsis, fever is there? Okay, that you are going to ask. Burning micturition is there? Burning micturition is there? Okay, that you are going to ask. Okay, So if any thrombophlebitis, okay, if they are having IV lines are there, any features of thrombophlebitis is there. Thrombophlebitis. Thrombophlebitis is there. Okay, fine. Next, you have to ask for features of mastitis. They are starting breastfeeding the baby, guys. They are breastfeeding the baby. Is there any features of mastitis? Difficulty in breastfeeding is there or not? Okay. So you have to examine. Okay, for that you should train. You have to examine. Okay, whether there is cracked nipples are there. Okay, so this you have to ask. The primary objective of repeating, guys. Okay, students commonly make mistakes here. This in the postnatal complication. They didn't even ask and come. The hemorrhage, sepsis, burning, micturition, thrombophlebitis, and mastitis. So these things you make sure that it should be there, guys. It should be there. Based on that, you can give advice, guys. You can give advice in terms of management. Okay, so extra calories, okay, exclusive breastfeeding, okay, family planning, family spacing, okay, between the births. If the family completed means family planning. Okay, so these are the measures, okay, which you can give it to them. Okay, fine. This is a case of postnatal case. If you are writing it, this is enough postnatal case. What about under 5 case? Okay, under 5 case. In under 5 case, what is key here? What is key here in under 5 case? Suppose it's a case of diarrhea. Only two things I want this. One is that what is any examiner, what they will look for. Okay, if it's a case of diarrhea, one is okay. So our job is to rule out dehydration. Rule out dehydration. For that, you have to follow the IMNCA guideline. Okay, IMNCA guidelines. So you have to look for okay, sunken eyes is there or not. Okay, okay, general condition. Four things you have to see: sunken eyes, general condition, skin pinch test, thirst. Okay, you have to see. Okay, this is what IMNCA guidelines. Okay, most of the time students not doing IMNCA guidelines. That is what they will expect. Okay, as a teacher, whether you know the IMNCA guidelines or not. Under 5 children, any child with diarrhea, so you have to ask, okay, look for general condition, you have to look for sunken eyes, that you have to ask. Plus what we will expect is what is the reason for this diarrhea? Environmental factor. Okay. Is there any environmental factors contributing to this? Second, and we will look for malnutrition. Malnutrition. So you have to child means you have to look for okay, is the child is having malnourished or not, underweight, okay, height, wasting is there, that you have to see. This is fine. This is under 5 diarrhea. If it is a child with respiratory symptoms, okay, child with respiratory symptoms, okay, that's not there. Okay, man. Last day's class, I have sent it from my side. I will ask them to put it. A child with a respiratory symptom, what I want, not I want, every teacher wants is that. So you should rule out pneumonia. That is the primary. To rule out pneumonia, again we have to follow. IMNCA guideline. Again we have to follow IMNCA guidelines. Okay, child with respiratory symptoms. Again we have to follow IMNCA guidelines. You have to make a diagnosis. No pneumonia, a child with acute respiratory infection. Your diagnosis should like this: ARI, acute respiratory symptoms, infection with no pneumonia or pneumonia or severe pneumonia. Okay, this is how you have to give the diagnosis: acute respiratory infection with no pneumonia, pneumonia or severe pneumonia. Here, a child with diarrhea, acute diarrheal disease with no dehydration, some dehydration, severe dehydration. You have to study, guys. Okay. So IMNCA guidelines: no dehydration, some dehydration, severe dehydration. And also, what we will look for, what you expect is what are the environmental factors that can contribute. environmental factors for pneumonia in the children. Is there any overcrowding? Is there any what we will say indoor air pollution is there? Okay, parental smoking is there? Okay, why the child got? Second, we will look for whether the child is malnourished or not. So don't forget to examine the baby, okay, properly. Fever and TB, guys. Okay, it's the question. Usually they will give the case of adult. Okay, adult for fever. Okay, so it's a fever. TB also can cause fever. So it comes as a differential diagnosis only. It comes whether it has features of malaria, features of dengue, features of TB. Okay, so you can give the differential diagnosis. Whether there is a features of malaria is there, dengue is there, and TB is there. Okay, so if you suspect malaria in management investigation, what investigations you would like to do? Then based on that, what treatment? Dengue, what investigations, what treatment? TB, what investigations, what treatment? Okay, so you have to ask history. Okay, is there any chills and rigor are there? Okay, intermittent fever is there? Okay, dengue means what? The fever can come with, okay, joint pains they will have, retroorbital pain may be there. What about TB means what? The patient may have other things. The patient may have a cough may be there. Okay, weight loss may be there. Okay, so you can go like that. You understood? It's a case of fever means we cannot make a definitive diagnosis. We can say the differential diagnosis. It may be a viral fever, okay, or it may be a UTA. UTA means patient will have burning micturition, okay, burning micturition. Like that you can make a differential diagnosis, and you can say that, sir, this is the investigation I would like to do. If it is confirmed, this is the treatment I would like to do. Okay, it's fine. If it's a case of TB, what investigation and what treatment? Okay, I will do sputum smear examination. Okay, and I will do chest x-ray. Then based on that, if I want, I will start the treatment related with the TB. So you have to know the theory of TB, you have to know the theory of malaria, you have to know the theory of dengue. At least you should know what investigation you would like to do and what is the treatment we should know. Okay, fine. So look here. So this is the outline, guys. This is the outline I have given to you regarding case discussion, guys. Okay, regarding case discussion, this is the outline. Okay, so if a case is given to you, you should know certain basic aspects. Okay, certain basic aspects. So based on that, you can write the management, guys. You have to study. Just use this. Okay, see that what case, what I am supposed to see. Already you know the subject. Okay, if you know the subject, it's easy. What case, what I am supposed to see. Time is there. Okay, you have time is there based on which college you study. Okay, is there any doubts, guys? Is there any doubts, or otherwise we can stop it? Yesterday's last class notes, Tehashish, I will ask them to add, guys. I will ask them to add. No MCQs today. This is practical class. Okay, hope it went well, and all the best from my side. Okay, understand this. Okay, practicals, it's easy. Okay, you need to know what to focus. Okay, if you focus, practicals are easy. Theory you can study, man. Theory you can study, that's not so difficult. Okay, thanks for listening, guys. Okay, all the best for your exam. Okay, thanks Nehashish, all the best for your exams. Okay, so once you pass, probably all of you will go for electives. Okay, thank you, guys. Thank you. Okay, thank you. Bye. Thank you, man. Thank you.